welcome back to 50/50 Day. We're talking about gender equity and progress in society. And with us right now, we've got Roopa Dhatt. She's a doctor, which you can kind of see from her surroundings, and the co-founder and director of Women in Global Health, which works to get more women in health leadership positions. You're also the founder of New Voices in Global Health, which I understand works with youth. So thanks a lot for joining us today.
Great, really excited to be here.
Yeah, you have a fascinating set of agendas and backgrounds, but I just want to say that in my family, there's a lot of people who are in health and public health. My sister worked in public health globally in the US for many years. She's still a practicing physician. And it strikes me that, health is one of these things that everyone has to deal with, rich and poor, every nation. What is it that you're looking at the most in your work, and what is it that you're championing?
Great. Yeah, so as you said, health does not discriminate, and it's illness can affect everyone, and being healthy it goes across borders. And particularly for us, what we notice is that women are providing care in their communities. A lot of it is unrecognized, not even paid. And if it is paid, it's underpaid. And so what we really focus on is that majority of the health workforce, about 75% globally, and in some places, over 90% of the health workforce is composed of women. But when we look at the leadership aspect, it's just the classic numbers. It flips over, and women are not really at the decision-making level, whether it is top leadership, roundtables on maternal, neonatal childcare related to reproductive health, or even all of health. And so we really work on advocating at the global level, but also working with national leaders to bring more women's leadership to the decision-making, since health affects all of society, and women are already working to address those issues.
Yeah, it's the caregiving issue has been something that's been tackled by people like I-Gen Poo and people who look at it from a work standpoint. And it sounds like you're looking at it both from the medical care standpoint and work and leadership. So what are the strategies that you see that work in getting more women into leadership in health positions?
Yes. So definitely, like what we've been focusing on, we were founded in 2015, and we realized that a lot of people are not even aware of the issue. So our first strategy is getting people to acknowledge there is a gender gap at the top. Unlike some other fields, most of the women are visible sort of at that health workforce level. So people forget about the top decision making. So one aspect has really been increasing awareness and getting people to recognize where the gap is, and also highlighting the complexity of the gap, that it changes in which sector you're working in. There's a private sector, an academia sector, a policy sector, and then we sort of really talk about, bringing it across the life course, whether someone is early stage or mid-career or senior career, and then really bringing that intersectionality lens, because the story changes what power, privilege, and background. So a lot of our phase one has been just really getting people to recognize the issue. The strategies that we've seen that have been quite promising is when organizations actually stand up and make commitments, but actually work toward reporting on those commitments, whether it is creating quotas or changing the way that their meetings operate, no longer saying we believe in gender equality, but actually making sure that their meetings, for example, always have gender parity, following the 60-40 rule that some of the Nordic countries do. So making it part of policy and making sure people are aware that that's policy, that's where that culture starts changing. And then eventually we're hoping that we really get to changing the mindsets, a lot of the conversations that we've been having today.
So how do you think that the leadership question then trickles over into decisions that we make about what medical care research agendas are pursued, what kind of care is covered? There's been much made of the fact that in many places you can get insurance to cover Viagra more easily than you can reproductive care for women. So how does the leadership gap then affect other aspects of healthcare?
Yeah, so as you were just saying, some simple things in certain countries, chocolate is tax-free, whereas feminine hygiene products are taxed. So that's still another example of where policy, not necessarily coming out of the health sector, but impacting health, is still really has a gender bias to it. So what we've seen is that particularly when we think about women's health, we really like to promote all of women's health. So there's often a tendency to only think about women when they're reproductive age. So sort of the adolescent to sort of the menopause, but really the challenges that women are facing in health include non-communicable diseases. Cancer screening is a big part of that. Diabetes, women's health outcomes are lower in these areas. So we really advocate for having women at that decision-making table so that we can have problems solved through really having all the lenses, the gender lenses, why women aren't accessing a health system, or where do we need to think about putting more resources or interventions. And so that's where women being at the leadership really can influence and make sure that we make the best decisions. And it's also not just only women. We also really think that it's about the diversity of voices and diversities from both the race, the class, and gender, sexuality, all of it. They really need to be part of making the health solutions. Otherwise, we're not going to be able to address the global health challenges.
So what are we seeing in terms of global health challenges? The U.S. has one set of laws, one set of insurance companies. You know, there's questions about access and of course, the debate over whether the healthcare law will change at the federal level. What other sorts of things should we be paying attention to, because we're part of a global community today, not just people in the United States?
Yes, and so the first aspect, like particularly coming for those people that are based in North America or based in the United States, one of the things to be really mindful of is that the United States is one of the largest donors for global health and development, 40% of the funds. And so when there's policy change happening nationally, it affects millions and millions of lives. And so if you are a citizen here, you do have the ability to call your Congress, your Senate, and influence that development is important to the health of people, not only just nationally, but globally. And then sort of thinking about the sort of global challenges, there's two things that we really are encouraging people to think about for all people. One is a universal health coverage. This is something the World Health Organization, as well as under the United Nations, over 150 countries have already agreed to making that a priority, that people get access and coverage to healthcare, and not just basic, but really being comprehensive. And the second really area is we really advocate that health is linked to the environment. And so we need to think about climate change and the impact climate change has on broader society. And women are often facing a burden of that. In many countries, they're cooking still in coal stovetops, a respiratory illness. So there is another disproportionate impact on women. And so really thinking about health, those would be the sort of two topics to keep in mind, and really focusing on comprehensive health care.
Well, thank you so much. Again, Roopa Dhatt, doctor and co-founder, director of Women in Global Health. All the best to you and happy 50/50 Day.
Okay, well, thank you too. Happy 50/50 Day as well. Thanks.